Climate change is the slow, steady warming of our planet. It is caused by human activities like burning fuel for cars and factories. These actions release gases that trap heat in the atmosphere. This makes Earth's temperature rise like a greenhouse, getting warmer and warmer. This warming doesn't just melt ice caps or cause strange weather. It also creates a perfect environment for tiny, invisible organisms to thrive. These organisms are germs, bacteria, viruses, and parasites. They are the agents of infectious diseases, illnesses that can pass from one person to another or from animals and insects to people. Infectious diseases have always been a part of human history. We know about things like the flu, which comes around every year. We have heard stories of cholera, a disease that spreads through contaminated water. For a long time, we thought we had these dangers under control, at least in some parts of the world. We built systems to clean our water and developed medicines to fight the germs. We understood where these diseases lived and how they behaved. But climate change is rewriting the rules. It is changing the environments where these germs live, making it easier for them to grow, multiply, and find new homes. Think of our planet as having natural borders for diseases. Certain illnesses were once confined to specific tropical regions because the germs needed constant heat and humidity to survive. Cold winters would act as a natural barrier, killing off insects or pathogens that couldn't handle the frost. But as the planet warms, these cold barriers are weakening. Winters are becoming milder and shorter. The lines on the map that once contained these diseases are starting to blur, allowing them to creep into new territories where they were never seen before. This silent expansion is happening right now, often going unnoticed until an outbreak occurs. This connection between our climate and our health is one of the most serious challenges of our time. It's not just about a few extra hot days in the summer. It's about the fundamental systems that keep us safe from illness. The warming trend is disrupting the delicate balance of nature. It empowers the smallest of organisms, giving them new opportunities to spread and cause sickness. Understanding this link is the first step toward protecting ourselves. We are not just fighting a changing climate, we are fighting the ancient enemies of humanity that are gaining new strength from it. Warmer temperatures directly help many diseases to spread. This is especially true for illnesses carried by insects like mosquitoes and ticks. These creatures are cold-blooded, which means their body temperature and activity levels depend on the environment around them. In warmer weather, mosquitoes grow up faster, from larva to adult. They also bite more frequently, increasing the chances of transmitting a disease. Furthermore, the viruses they carry, such as dengue or Zika, also replicate faster inside the mosquito's body when it's hot. This means the mosquito becomes infectious more quickly, ready to pass the virus to the next person it bites. Climate change also brings more extreme weather events. We are seeing more intense rainfall and flooding in some areas and longer periods of drought in others. Heavy rains can overwhelm drainage and sanitation systems. This leads to standing water, which becomes a perfect breeding ground for mosquitoes that carry diseases like malaria and West Nile virus. When floods contaminate drinking water sources with sewage, they create the ideal conditions for waterborne diseases like cholera and typhoid to flourish. These are illnesses that can spread rapidly through a community when people are forced to drink and use unsafe water, a common situation after a natural disaster. A clear example of this is the journey of the Aedes aegypti mosquito, the primary carrier of dengue, Zika, and chikungunya. This mosquito species was once limited to tropical and subtropical zones. It could not survive the cold winters of Europe or North America. However, as global temperatures rise, its habitat is expanding. We are now seeing this mosquito in southern parts of Europe and the United States, places where it was once absent. This means millions of people who never had to worry about these diseases are now at risk. The map of disease is being redrawn by a warmer climate, bringing old threats to new doorsteps. Similarly, ticks that carry Lyme disease are also on the move. These small arachnids thrive in warmer, more humid conditions. As winters become less severe, more ticks survive into the spring, and their active season lasts longer. They are expanding their range northward into Canada and to higher altitudes in mountainous regions. People living in these areas who once considered themselves safe from Lyme disease now have to be more cautious when spending time outdoors. It shows that even a small, steady increase in average temperature can have a big impact on the geography of infectious disease, changing who is vulnerable and where. This expansion of infectious diseases is not just a problem for a few specific countries. It is a global health challenge that affects everyone, everywhere. In our interconnected world, a disease outbreak in one region can quickly become a threat to people thousands of miles away. International travel and trade mean that a person infected in one country can carry a disease across the globe in less than a day. An infected mosquito or tick could even hitch a ride on a cargo ship or airplane. Because of this, no country can truly isolate itself from the health impacts of climate change happening elsewhere. The burden of these changes often falls hardest on the most vulnerable communities. People living in poverty with limited access to healthcare, clean water, and sturdy housing are most at risk. After an extreme weather event like a hurricane or flood, these communities may lack the resources to rebuild quickly or to protect themselves from the diseases that follow. Children and the elderly are also more susceptible to both the direct impacts of heat and the infectious diseases that thrive in it. This creates a cycle of inequality, where the effects of climate change make existing social and economic problems even worse for those who can least afford it. Furthermore, healthcare systems around the world are not always prepared for these new or expanding threats. Doctors in regions where diseases like dengue were once rare may not recognize the symptoms, leading to misdiagnosis and delayed treatment. Public health departments may not have the resources to monitor for new insect populations or test water sources effectively after a flood. Preparing for these climate-driven health risks requires investment, training, and a new way of thinking. We must start treating climate change as a public health emergency, not just an environmental issue. The stability of our global health security depends on it. Ultimately, the spread of disease is a clear sign that our health is deeply connected to the health of our planet. The same activities that are warming the atmosphere are also creating pathways for pathogens to reach us. A sick planet leads to sick people. This isn't a problem for the distant future. It is happening right now. From farmers in Southeast Asia facing new strains of malaria to families in Florida worrying about Zika, the consequences are real. Recognizing this shared vulnerability is the first step toward building a united front against this growing challenge, because a threat to one is a threat to all. Even though the challenge is big, there are practical steps we can all take to protect ourselves and our communities. Simple actions at home can make a difference. We can reduce breeding grounds for mosquitoes by regularly emptying standing water from things like flower pots, old tires, and bird baths. During peak mosquito hours, wearing long sleeves and using insect repellent can provide an effective barrier against bites. Being aware of the specific disease risks in our local area helps us know what signs to watch for and when to seek medical advice. These small personal habits contribute to a larger community-wide defense against vector-borne illnesses. Communities can also work together to build stronger defenses. Investing in and maintaining robust public health systems is crucial. This includes better surveillance programs to track insect populations and detect disease outbreaks early. It also means ensuring that everyone has access to clean drinking water and effective sanitation systems, especially after extreme weather events. Planting more trees and creating green spaces in cities can help lower local temperatures and manage stormwater, reducing the heat island effect and potential breeding sites for pests. Public education campaigns can empower citizens with the knowledge they need to stay safe and healthy in a changing climate. On a larger scale, the most important action is to address the root cause of the problem, climate change itself. This requires a global effort to reduce the greenhouse gas emissions that are warming our planet. Transitioning to clean energy sources like solar and wind power, protecting our forests, and adopting more sustainable ways of living are essential. While these are big long-term goals, every government, company, and individual has a role to play in this transition. By working to slow down the warming of our planet, we are also directly protecting human health from the many threats that climate change amplifies, including the spread of deadly diseases. This is not a story of despair, but a call to action. We have the knowledge and the tools to face this challenge. We understand the science, we see the connections, and we know what needs to be done. By combining individual responsibility, community action, and global cooperation, we can build a healthier and more resilient future. The path forward requires us to think of planetary health and human health as one and the same. If we work together with purpose and hope, we can protect both our world and ourselves from the silent threats that are gathering on the horizon.